Flashcards 101 to 150. 101Q. What is trigeminal neuralgia? A. Sudden severe facial pain along the trigeminal nerve. 102Q. What medication is first line for trigeminal neuralgia? A. Carbamazepine. 103Q. What is a major risk of carbamazepine? A. Agranulocytosis, low WBC. 104Q. What is the hallmark symptom of cluster headaches? A. Unilateral eye pain with tearing and nasal congestion. 105Q. What is abortive treatment for cluster headaches? A. 100% oxygen. 106Q. What is preventative treatment for cluster headaches? A. Verapamil. 107Q. What symptom distinguishes migraine from tension headache? A. Photophobia and throbbing pain. 108Q. What is the aura phase of a migraine? A. Sensory disturbances before the headache. 109Q. What medication is contraindicated in hemiplegic migraines? A. Triptans, risk of vasoconstriction. 110Q. What is a hallmark symptom of encephalitis? A. Fever, altered mental status, seizures. 111Q. What virus commonly causes encephalitis? A. Herpes simplex virus. 112Q. What is the treatment for HSV encephalitis? A. Fluorocyclovir. 113Q. What is the hallmark of West Nile virus infection? A. Flaccid paralysis with fever. 114Q. What is Creutzfeldt-Jakob disease? A. Rapidly progressive dementia caused by prions. 115Q. What EEG finding is seen in CJD? A. Periodic sharp wave complexes. 116Q. What is a key sign of basilar skull fracture? A. Battle sign or raccoon eyes. 117Q. What should be avoided in suspected basilar fracture? A. Nasogastric tube insertion. 118Q. What indicates a concussion? A. Temporary LOC, headache, confusion. 119Q. What is second impact syndrome? A. Rapid brain swelling after a second concussion. 120Q. What is post-concussion syndrome? A. Symptoms lasting weeks, headache, memory issues. 121Q. What is diffuse axonal injury? A. Widespread shearing causing coma. 122Q. What is the hallmark CT finding in diffuse axonal injury? A. Multiple small hemorrhages. 123Q. What is the priority in traumatic brain injury? A. Maintaining oxygenation. 124Q. What BP goal reduces secondary brain injury? A. MAP greater than or equal to 65 mm of mercury. 125Q. What is an early sign of increased ICP? A. Restlessness or confusion. 126Q. What is a late sign of increased ICP? A. Cushing's triad. 127Q. What condition causes papilledema? A. Increased ICP. 128Q. What medication reduces CSF production? A. Acetazolamide. 129Q. What is the function of the oculomotor nerve? A. Eye movement and pupil constriction. 130Q. What cranial nerve controls facial sensation? A. CNV, trigeminal. 131Q. What cranial nerve controls hearing and balance? A. CN8, vestibulocochlear. 132Q. What cranial nerve deficit causes dysphagia? A. CN9 and X. 133Q. What is expressive aphasia? A. Difficulty producing speech, Broca area damage. 134Q. what is receptive aphasia? A. Difficulty understanding speech, Wernicke area damage. 135Q. What is global aphasia? A. Both expressive and receptive impairment. 136Q. What is apraxia? A. Inability to perform purposeful movements. 137Q. What is agnosia? A. Inability to recognize objects. 138Q. What is neglect syndrome? A. Ignoring one side of the body environment. 139Q. What intervention helps neglect? A. Place objects on the unaffected side initially. 140Q. What is ataxia? A. Uncoordinated movements, cerebellar dysfunction. 141Q. What is dysarthria? A. Slurred speech due to weak muscles. 142Q. What is dysphagia? A. Difficulty swallowing. 143Q. What diet is safest for dysphagia? A. Thickened liquids and mechanical soft foods. 144Q. What stroke deficit increases fall risk? A. Hemiparesis and poor balance. 145Q. What is the recommended BP goal before TPA? A. 185, 110 mmHg. 146Q. What imaging rules out hemorrhage in stroke? A. Non-contrast CT scan. 147Q. What is permissive hypertension in stroke? A. Allowing higher BP to maintain cerebral perfusion in ischemic stroke. 148Q. What BP indicates permissive HTN is too high? A. 220, 120 mmHg. 149Q. What heart rhythm commonly causes embolic strokes? A. Atrial fibrillation. 150Q. What medication prevents embolic stroke in AFib? A. Anticoagulants, warfarin, DOACs. Your hard work will pay off. For more videos, join our Patreon now at patreon.com at New Nurse Tunes 2025 patreon.com. Thank you for watching. Please like and subscribe.